I want to speak directly to every man over 60 watching this. There is something you are almost certainly doing every single morning, something considered healthy, something you have done for decades, that is directly contributing to the growth of your prostate. Not because of your age, not because of your genetics, because of what is happening inside your body within 30 minutes of waking up. I am going to tell you exactly what that habit is. But first, I need to show you the mechanism. Because when you understand what is actually happening at a biological level, you will never look at your morning the same way again. I started asking my patients with rapidly progressing BPH one question I had never thought to ask before. What do you eat and drink in the first hour of your morning? The pattern I found, and across patient after patient, stopped me cold. One man's prostate was enlarging faster than his age could explain. We identified his habit. We changed one thing. 6 months later, measurable improvement for the first time in years. Here is what that habit is doing to your prostate, and here is how to stop it. Starting tonight. My name is Dr. Sophie Martin. I'm a urologist with over 20 years in clinical practice. And what I am about to tell you, your doctor has almost certainly never connected it to your prostate health. Now, before I name the habit, I need you to understand the mechanism, because this is the part nobody explains. Think of your body's hormonal system like a thermostat. It does not act on its own. It responds to a signal. Change the signal, and the system follows. Every time your prostate works the same way, it responds to hormonal signals, and something you are doing every morning has been sending it the wrong one. Here is the pathway, 3 steps. Step 1, you consume something high in sugar or refined carbohydrate. Your blood glucose rises rapidly. Your body releases insulin and the hormone that pulls sugar out of your blood. A large glucose spike means a large insulin spike. In the morning, after an overnight fast, that spike hits harder and faster than at any other point in the day. Step 2. Elevated insulin triggers the production of IGF-1, insulin-like growth factor 1, a hormone with one primary job: tell your cells to grow and divide. Under normal conditions, useful. Chronically elevated morning after morning, or a problem. Step 3. Prostate tissue is packed with IGF-1 receptors. When IGF-1 rises, prostate cells receive a direct growth signal. Do this every morning for 10, 15, 20 years. The cumulative effect on prostate volume is measurable. A 2015 study in the British Journal of Cancer confirmed the association between elevated IGF-1 and prostate tissue proliferation. This pathway is not theoretical. It is directional. So, what is spiking your insulin every morning? What is sitting in your kitchen right now? Something you have reached for 1,000 mornings in a row, sending your prostate that signal without your knowledge? Here it is. The habit is your morning sugar, specifically the high glycemic food or drink you consume in the first 30 minutes of waking. Before your body has eaten anything, before your insulin is stable. In the window, when a glucose spike travels fastest and hits hardest. Here's what that looks like in most men's kitchens. A large glass of orange juice, the one most men over 60 consider a health essential. A bowl of sweetened breakfast cereal, the same one that had been in the cupboard for 30 years. A flavored coffee drink, the latte with syrup, the sweetened instant, consumed before any food has touched your stomach. White toast with jam, eaten without protein. Nothing to slow the glucose from hitting your blood. Any one of these consumed first thing on an empty stomach every morning produces the insulin spike that drives IGF-1 production, and IGF-1 tells your prostate cells one thing: grow. I am not saying this caused your BPH. Prostate enlargement has multiple contributors: age, genetics, inflammation. I am not dismissing any of them, but I am saying this clearly and without qualification. If you have been doing this every morning for 10, 15, 20 years, you have been providing your prostate with a daily growth stimulus that nobody warned you about. And that is something you have the power to stop. Tonight, what did your morning look like before you heard this? Tell me in the comments, because I want every man reading those answers to understand he is not alone in this. Here is what to do instead. This is not a complicated change. It is a sequencing change. It is about what comes first. Consume protein within 30 minutes of waking and before any carbohydrate, any juice, any sweetened beverage. That is the entire protocol. 2 eggs in any form, full-fat Greek yogurt, no added sugar, a small handful of unsalted nuts, a protein smoothie, water or unsweetened milk, no juice, no added sugar. Protein consumed first blunts the insulin spike of any carbohydrate that follows. It slows glucose absorption. It suppresses the IGF-1 surge. Your prostate does not receive the growth signal. You do not have to eliminate juice. You do not have to eliminate cereal. You have to move them. Protein first, everything else after. That single sequencing change, like starting tomorrow morning, removes the daily growth stimulus your prostate has been receiving. Had you ever been told that what you eat first in the morning has a direct connection to your prostate health? Tell me in the comments. Because in 20 years of clinical practice, I can count on one hand the number of patients who had, and I want to tell you about a patient. I'll call him Arthur. 69 years old. Retired. Health conscious by every measure he knew. Read food labels, walked every morning, took his medication without fail. He came to me for a second opinion after 3 years of worsening symptoms. Nighttime trips to the bathroom, 3, sometimes 4. A urinary stream that had slowed to almost nothing. His prostate was enlarging faster than his age could explain. Every doctor had told him the same thing. And this is what getting older looks like. Learn to manage it. During our consultation, I asked him one question. What does your morning look like? He described the same breakfast he had eaten since his 40s. Large glass of orange juice, bowl of sweetened cereal, coffee with 2 sugars. Every morning, without exception, 30 years of the same routine, and every doctor he had ever seen had called it responsible. I explained the mechanism, the insulin spike, the IGF-1 surge. What his breakfast had been telling his prostate to do every single morning, yet for 3 decades. He was quiet for a moment. Then he said, I thought I was taking care of myself. Turns out I was making it worse. 15 words. No medical language. Just a man realizing that what he believed was protecting him had been working against him the entire time. We made one change. Protein first, every morning. 6 months later, his symptom score had improved meaningfully for the first time in 3 years. He told me the thing he had missed most was sleeping through the night. He got that back. He did not change his age, he changed the signal. Here is what I need you to take from this. Prostate enlargement is not purely inevitable. It is partly driven by signals. And signals, unlike age, can be changed. The most powerful prostate health intervention available to you right now is not in my office. It is in your kitchen, on your counter, and what you reach for first tomorrow morning. You heard this today. Tonight, you can prepare differently. Tomorrow morning, you can begin. And your prostate, for the first time in years, will not receive that signal. So let me leave you with this. The habit is your morning sugar. It's the high glycemic food or drink you consume first thing before your body has eaten anything. The mechanism is the insulin spike it produces, the IGF-1 surge that follows, and the daily growth signal that delivers to your prostate tissue. The replacement is simple. Protein first, every morning, before anything else. That single sequencing change removes the signal entirely. Are you going to change your morning tomorrow? Tell me in the comments. And tell me what your morning has looked like until now, because your answer might be exactly what another man needs to see. If there is a man in your life whose morning looks like the one I described, share this with him. One video, one change, one morning. That is all it takes to start. Take care of yourselves. Your prostate has been listening to what you eat every morning. Now you know what to say. Everything I have shared today is based on published clinical research and over 2 decades of patient care. But it is general information, not personal medical advice. If you have existing prostate conditions, diabetes, or are on medications that affect blood sugar, please discuss any dietary changes with your own doctor before implementing them. That conversation, specific to your history and your health, always comes first.